we're going to talk about how to take the end of your sentence, which was ending with an exclamation point, and turn it into a question mark. And that's, if you take away anything, saying question mark at the end of something you said is a fine way to improve your practice. I had the now ABPN president, Jeff Linus, as my mentor in medical school for medical education. And he told me, tell him what you're going to tell him, and tell him what you told him. So in that format, some learning objectives, we're going to define this wonky word, mentalizing process, mentalization, and more annoying word. This is all language that was created in the context of the Anna Freud Center in the UK. So it's analysts describing to other analysts why they should stop sitting silently. And that is the cultural context of the branding of some of these terms. Make up your own is the direction we will have for you. We're going to talk a little bit about attachment and the underlying theory. That's crucial. We're not going to get into the nitty-gritty. How mentalizing goes wrong. How people can have question marks intrude into their daily life, or exclamation points, when it should have been question marks. My favorite metaphor for this recently is narcolepsy. It's normal to have REM sleep in sleep. It's not normal to have it intrude upon wakefulness. And if that's what's happening, you have a problem. This is the same with mistrust intruding on what should be trust, or trust intruding on what should be mistrust maladaptively. This is my adorable child Quinn. We have two of them, Trent and Quinn. They are 7 now, looking at someone who may or may not be one of our co-presenters. But you can see there's a lot going on in the baby's glance before there's any language. They need to get fed and changed, or they're going to die. And they don't have any words. And that's like, they've got to bring their A game of cute or crying or whatever to get the attention. That bid for attention from a caregiver is a life or death issue for babies. That same life or death issue for babies' brain circuitry persists when we develop symbolic representation, aka words to say things. So the same feelings that got us to so frantically love or be cute are the same feelings we're dealing with when we have words, even if they're not happening adaptively. And so the argument is what you're looking at is an intrusion onto what is not the right context of these very early frantic bids in kids who have these sorts of problems. The ability to hold the mind in mind is one definition of mentalizing. One of the issues with mentalizing is it's a wonky word, and I would encourage you to think of that as a bonus, because nobody will have any idea what it means. And so you're free to define it together. And the process of defining the word is the thing. It's all golf swing, right? If you're trying to figure out what's wrong with some golf game, by x-raying a dude, you're only going to get so far because it's a functional problem with the swing. You need a video. And in mentalizing the process, we're talking about a functional problem in executing your emotional connections with others, right? And so there's movement and process that we're talking about over and over again, not just structure and the function of that structure. There are other definitions I will share, and we'll see examples throughout. So seeing oneself from the outside as others might see you, and hey, you got sing over here. Sing over here. It's good. Right. The ability to imagine that someone is looking at you cross-eyed because you have something on your beard, that's mentalizing. He has in mind, he's looking at me funny, maybe there's a reason he's looking at me funny, as opposed to, what the wrong with you? And that, seeing oneself from the outside, and similarly, at the same time, seeing others from the inside as they might see themselves. Seeing someone who looks angry and imagining there may be a reason other than, for their anger, that process of imagining an internal state at the same time as you observe behavior and coming up with a question mark about why that might be. That is what we're talking about. Oh, you were at the other Starbucks. Oh, maybe the connector is broken. And it's not just that you're an idiot who doesn't know how to do it, right? Those moments where we work out, there were 2 Starbucks on the same block, you didn't stand me up, we're all good, as opposed to cutting everyone out of your life who doesn't meet you at the right Starbucks in, when there's a bathroom in the area, Starbucks bathroom, and you didn't go. It's the process of a small child getting a gift for mom. This is from our colleague Ephraim Bleiberg. Mommy, I got you what you wanted for your birthday. It's a dump truck. Now, in the child's mind, that's normative. What he has in his mind as the best birthday present is a dump truck. He knows he wants a dump truck, and thus what is in the mind of the other person is also a dump truck. What is in my mind is in your mind, is a very early and appropriate developmental stage for kids. I'm hungry. We're hungry. I need to be changed. We need to be changed. So this is a really easy misunderstanding in early childhood. And if you imagine that continues into adulthood sometimes, you got the idea. Understanding a misunderstanding. Right. So I've defined this 4 different ways because it's not about any one definition. The actual definition is like a paragraph long. Imagined internal states to drive. Blah. Oh, no, I got it, right? That's the process of mentalizing. And when that's not happening, when we get very sure, and I said we on purpose, these are in dyads or groups, and the more people around, the less mentalizing happens. Try to convince one other person to pick up a pitchfork and go burn the witches. It's hard. Try to convince a group, not a problem. So the ability to be curious about internal states drops in high stress environments and in large groups, etc. And we don't try to... I'm imagining they don't know how loud they are. I'm going to quickly say, it would be awesome if we could... Thank you, I appreciate it. My realization the other day, this is not my child, but I'm going to pretend it is. I am very proud, as is my mom, of the fact that I'm a doctor. And when my child, not my child, picked up a stethoscope, and I'm like, he wants to be a doctor also. And then he takes it. Welcome to McDonald's, can I take your order? God, I failed as a pediatric subspecialist. Okay. But, and this is, my son actually loves McDonald's, my daughter hates it. And it's now like, this was a joke originally, and now it's just part of our life that I feel deeply conflicted about. This ability is based in attachment. These are our twins at a very early age. And they got it, right? You're here for me, I'm here for you, we're in this together. This is not a question for them. And they don't even have a word before the question mark. They just have an exclamation point for each other. So these abilities are developing extremely early before we have symbolic representation, which is the oven mitt that lets us hold on to our stuff without getting burned. And these attachment styles predict how we will behave later. The data on this is not as robust as I'd like it to be in terms of how predictive it is. But these are conceptual examples, and there's science on it. But if you think of theory of mind that comes and goes, you're in the right general vicinity. These are Harry Potter Legos. And I took these pictures so I wouldn't violate any copyright. And that's great. And then I don't love the Harry Potter stuff anymore. But we can all agree that if you've read any Harry Potter or heard about it, that there was some early stress, trauma, neglect, abandonment, but it only needs to be right a portion of the time, about 30% between parent and your caregiver and child, for it to be good enough. Because the process of learning to figure out what's going on in somebody's mind, that there could be an understanding and that we can understand it, that process is best when it's not perfect. You need to have some error built in. A perfect therapist who always gets it isn't as helpful as a sometimes right therapist. A perfect parent is less good than a sometimes wrong parent who can work out that they got it wrong with their child. So secure attachment, when we take these early videos from Mary Ainsworth, that would occur when we have kind of this accurate assessment of the child's needs about 30% of the time. So good enough is better than perfect. Insecure attachment, again, illustrated with Legos. So the strange situation, I imagine everyone in this room has seen these videos. If you have not, feel free to review them again. Mary Ainsworth got a video camera and took John Bowlby's work, and the strange situation was parent in room, 1-year-old in room, or slightly less, and stranger. And what happens is parent gets up and leaves, and they video it, and video is awesome for empiricism because it means we can play the video back and independently rate and code and measure what happened. Before video cameras, everything about how humans act or think or feel was people thinking about it later, and that's prone to error. And so video brought empiricism to human interactions, and that's where this attachment work comes from. And so what we see is in some portion of kids, when there is not enough of this, they will cling to the parent and never let go. When the parent leaves the room, they get anxious, parent comes back, that's the end of the strange situation. What the kid does is the thing, right? And so you have some kids who just go. Now, often there's a parent also involved. It's not just the kid problem. The parent probably has something to do with how the child behaves. And so there's anxiousness in the dyad, right? The other style we see is this avoidance style. When we learn very early that we're not going to get our needs met, well, then it doesn't make sense to go cling on to mom. And we're just going to look like it doesn't matter. Stare off into space. And the other thing we see is disorganized attachment, where there's no predictability for the kid. They're to the stranger and to the sign. Like, why are you, right? And this is the most disrupted attachment style that we see. And basically, insecure is all you need to know. None of these specifics matter, but you can recognize that some of these behaviors that we see from our patients, where they're inappropriately engaging in later adolescence, adulthood, etc., that comes from these very early experiences of neglect, trauma, abuse, or just misattunement. This is a photograph of an adult patient who was a fan of Lego in my office after a very misattuned session. And this person had disorganized attachment, so these things were all thrown at my head at one point in time. Whoa. Yeah. One of the working definitions we have for what a personality disorder is it's an acquired mistrust in social information. You learn not to trust it. And that's adaptive in some contexts. So what is 2 plus 2? Anyone?
We learned that it's 4.
If you learn that it's 4, wrong! 2 plus 2?
Somebody could say 6.
4, wrong! 2 plus 2? Great job! It's very unsettling, right? So why are they wrong and I'm right? And that mistrust, that is what kids are gaming out, because they're both taking what they know to be true, and they're taking the social information about what they should trust or shouldn't, and they're trying to come up with some answer. And there's error in that process. So if we think about how long it takes to learn the crucial lesson of whether we should go with the man in the free candy van, that's fast. Kids pick that up really quickly. And so we have a system which is caregiver-child relationship that communicates how important it is to learn something. Because I never had my mom sit down with me and say, Owen, if you don't learn long division today, you're going to die. And it would be important that you get it right. I can't divide to the, if you gave me I had a gun in my head, I could not do it. I think I would probably just have to, that's an execution for me, it's long division plus gun. Because it wasn't socially communicated that it was the most relevant thing. There are some things we learn incredibly rapidly because the caregiver we trust communicates that it's crucial information. Don't go with the bad man. And we have adaptively a system to keep out other information. Mistrust saves our life. George Orwell's novel 1984 was all about this. I use 1984 so I don't have to talk about politics, but for organizations and for you individually, again, if you get really hot on this, you're like, this is the mistrust, yeah, I can sell that, and you go, let's bring in an expert. Oh, right. There's built-in mistrust in institutions. And so the best person to communicate information about something new is someone who has trust already. This is why if you want to, like, McKinsey has a whole business as consultants, because they just come and say, you should fire people, and nobody wants to send internally, and they've just done the service of outsourcing the mistrusted person to the evil consultants, and they get paid billions of dollars to do that, because if they had good information, well, they have they're experts, and that's nice. Getting it implemented in your setting, look for who has the trust. So what is the goal of mentalizing this concept when we turn it into a psychotherapy, which we're going to give you a very basic overview and a couple of skills for today? And it's really simple. Like, hopefully you believe me, but if a patient or the dyad is not mentalizing, get them mentalizing. That's it. If they are mentalizing, keep them mentalizing. That's it. You don't have to have an insight, you don't have to teach a skill, you just have to get back to mentalizing. You can talk about sneakers. It doesn't matter, is our argument, and that feels strange when we're so good and have so much information to communicate about what's important. The argument that mentalization-based treatment does is all that information is important, and the time to convey it is when individuals are mentalizing. If you want to teach a skill, then. Not other times, then, because it will fall to pieces if you don't. We have this concept, and we're going to spend probably the most time on this and the non-mentalizing modes, but there is a stance to mentalizing. We have this IKEA table. We start with inquisitive and curiousness, not knowing, and in some institutions this goes over less well. Some really like to lean into knowing what to do. And MBT would argue that not knowing is a source of power. And being curious makes everything we say more palatable, especially because we don't know how much trust or mistrust is walking in the door. And so I think we should do this, but I'm not sure if that's what's in your mind, ? That's the stance we're taking. Punctuating non-mentalizing is another thing that is an aspect of this model that can differ from other psychotherapies. So in psychoanalysis, wait for more material silently is often the recommendations I got from my supervisors. Peter Fonagy, who co-created mentalization-based treatment, I heard him described by another analyst as, that Peter Fonagy never shuts up. Now, there's a reason he will interrupt, and that's because if we see people in a non-mentalizing mode, given the only goal is to get people mentalizing, he will stop them. And so your hand, hold on, and with Zoom it's great because you just put it up in front of the camera. Works really well. But it doesn't matter how you do it. It's just if they're going to go on, and you know they're not mentalizing, or you know you're not mentalizing, stop it. The only goal is to stop it and get it happening again. Because going on about something that's not mentalizing is, in this model, iatrogenic, and that's a different recommendation from other therapy models. Highlighting good mentalizing is otherwise known as behavioral reinforcement, right? It's the PCIT of MBT. If you see mentalizing, great job, right? All these things that you learn from anything else continue to be true. People love attention. Give them attention for doing a thing you want them to do, you will get more of it. Right. And holding the balance between polarities. So if someone's stuck on themselves, you can pull to other. Because good mentalizing is the ability to go from self to other and other to self. And to look at my wife nodding at me and go, it's making a good enough plan, I'll load it. Too hot, too cold is the other kind of really basic concept. So the ability to be curious is something that is not adaptive all the time. If a tiger is coming to eat you, curiosity is not your friend, because you'll get eaten. And if you don't care, because you shouldn't care, it's exhausting to care. And if you were to think deeply about the internal experience of the guy, selling you your Kit Kat and taking to, you would just fall over the street. You don't want to mentalize everyone on the street. God, who cares about that? Well, it's not adaptive to care all the time. It's not adaptive to care never. In close relationships, it's really adaptive to wonder when something's going wrong, why, as opposed to being a tiger's going to eat me, or whatever. Right. So being emotionally too cold and certain bad, being emotionally too hot and certain bad. In some contexts, in others, it may be life-saving, right? Because it's much like my narcolepsy example. When you sleep, you should have REM and be unconscious. Then it should not intrude onto wakefulness. And so these are normal in some contexts. They're normal developmentally. They're not bad per se, but being able to be curious sometimes and helping our patients hold on to curiosity in moments of distress. That is what we're trying to build. The joke I did once was wrote number of F's given as the labeling on the axis, and kids love that. Some adults don't.
I'm sorry, say that again?
So that's a swear word.
That's a what?
The number of F words given was very appealing to one particular colleague and her sassy teenage patients. And so it was a surprise, and we'll talk about the role of surprise a little bit later, but how much you care. I don't give an F. Too much of that bad. I give just the right number of Fs in the middle. And I don't get it all. Right? And that, too cold. Right? So the amount you care matters, and we're going to break this up in the subsequent only 3 non-mentalizing modes. I am a very simple person. I was not good at therapy. When I went and did the training for MBT, I was relieved that I only had to learn 3 things. And that seemed doable. And here I am. Lo, these many years later. So when you're too cold, we call that pretend mode in the manual. I encourage you and your clients and patients to rechristen this in whatever way you like. Whatever, I don't know, too cold, not engaged. On the too hot side, prove it. In the manual, we call it teleological mode, because that applies and appeals to therapists in the UK. And feelings equaling the facts. I know you hate me. Anyone seen Columbo? Were you old enough in this room? He was it's just one more question. Now, historically, he's a good model of what it looks like to kind of do this stylistically. I think he's actually kind of antisocial because he knows the truth. He's coming. But just what? He's trying to get him. He's trying to trip him up. That guy is a manipulative bastard. Columbo's a remarkable character, and one of the better examples of someone using curiosity in a way that, at least in his context, because he really did know, he's trying. He's a detective. He's not there for you. Whatever. Curious George, a lovable monkey who also is pretty curious, maybe a better example. So this genuine curiosity, I'm just not getting it yet. That is what we're encouraging you to use when, and this is important, you actually don't get it. So this whole training will boil down in practice to when you're sitting there with a patient thinking, I don't know what to say. Saying, I don't know what to say. Because that's the right thing to say. And it's remarkable how much of the time, almost universally, every time someone says, but I'm wondering how I could say. And so what you say is, but I'm wondering how I could say this to you. And I'm worried I'm going to get it wrong. And if you just take that internal monologue and say it, things go better. Question. So that's the stance we highlighted before that Peter Falk as Columbo showed for us, and we're going to demonstrate this in the subsequent bits. There are polarities. I'm not going to spend a lot of time on this because it's a short version. But someone who gets stuck on themselves. Do you have a question? Or you're looking up? Okay, you can have them. I like those. They're great. But what we're looking for is someone who's really stuck on themselves, on someone else, on a cognition versus an affect. We're looking for someone who can smoothly transition. And so a simple kind of check in MBT therapy for whether someone is mentalizing is just saying, well, what do you imagine I would think about that? If they can't do it, they're not mentalizing on average. I don't know. I need to get mentalizing online. And so the process of this is recognizing 3 modes. And honestly, these days I probably break it down to 2, cold and hot. But originally, in the weekend that Peter and Anthony had in the UK to come up with what to say to their colleagues at the Freud Center, and they did it literally in a weekend and talk at conference. I'm not sure we did this right. Okay, well. So we're going to start, and there's a series of these slides, and this is basically the whole talk, which is how do you recognize when mentalizing isn't happening, and then what do you do to get it to happen again? And when it's happening, anything else you want to do is fine. Everything else you've ever learned about being a human, or therapist, or doctor, or whatever, fine. And I would also asterisk, if you're thinking, hey, maybe this would work with my colleagues too, you're correct. And most of what I do in my day, I do accelerated neuromodulation treatment with giant brain magnets. But thinking about why it's not paid for, right, uses this mentalizing skill set. And so everything we're talking about in the context of a client and a therapist, or a patient and a doctor, all those things apply to other interpersonal interactions where misunderstandings might occur. So the first 2 hot mode looks like a lack of doubt, complete certainty. My example for this is Destiny's Child. And remember, say my name. Okay, so I have some of the committed memory. So every other day I would call, you would say, baby, how's your day? But today it ain't the same. Every other word is yeah, okay. Could it be that you were at the club with another lady? She's not sincere in that question. That's an exclamation point. Right? She knows he's cheating, and she is sure she's going to catch him. If you took it there, first of all, let me say, I am not the one to turn around and be played. Keeping herself together, her sense of self will be reassured. So prove yourself to me, the one that you claim. Why don't you say those things you said to me yesterday? Yeah, say my name. Say my name. If no one's around you, say, baby, I love you. If you ain't running game, which she's sure he is. It's not a sincere question. And that we see in our kids, right? They are sure that we are on the take from drug companies, that we have gotten our vaccine rebates from whatever it is. You're just doing this for the money, right? Say my name, prove that you care. And the feeling that we are on the take, the feeling that they shouldn't trust us becomes the fact that we are untrustworthy and crooks, or whatever it is. The same can be true of their parents, the same can be true. So we have to hospitalize this young man. What's it going to change? Well, we have to. And so what we're seeing in this mode, which we can get sucked into too, I have to do this, is this lack of doubt, certainty, the word just will show up a lot, and the feelings will become the facts. And in our own experience as therapists, or even just humans, we're going to notice that we feel fed up, that we might feel very confused, that we want to argue. But no, I really do care about you, and I want to prove to you that I'm not doing anything bad. I'm a good, kind, decent person who's only doing this out of the goodness of my heart. They don't pay me enough, and what do I even say? Right. And so we're recognizing from our own experience of that we might be in a non-mentalizing mode together. And so there's some things that we recommend, and then we're going to get to practice all these things. But they are validation. And if you've learned DBT, there are 6 levels of validation. This biases to higher level validation, radical genuineness. But you're not done validating until you're done, right? Validating once, this must be hard for you. Okay, I've validated, now I can go on. No, it must be hard for you. That's what I think. Is it hard for you? What's the hard part? Oh, I'm still not there yet. So being as confused as you actually are, and relentlessly getting to a place where you can understand, that's the kind of validation we're talking about. That curious stance we talked about from the mentalizing stance, a little balance in your knees, a little shake, I'm not sure. Being as confused as you actually are. Someone says something like, yeah, well, I took 20 Xanax because I wanted to, I just thought it'd be good for my... Wait, what? Good? So like when you're actually confused, just being as confused as you are is an approved technique in a fancy therapy model from the UK that you're hearing about at a national meeting. You have a permission slip to be confused. Just when it gets too hot and they're too fixed on it, just eject. Distract and return later. In the middle, I have to kill myself. What about the Bengals? I actually don't know anything about football, do you? What were we talking about? Oh, yeah, no, we were talking. So anything else, because it's just not, keep going on the train tracks of non-mentalizing is iatrogenic. So stop in cowabunga on a table. I have rolled on the floor of my office making snow angels with no snow with patients because nothing was doing anything. And so that was as good as anything else. And what are you doing, Dr. Muir? I know, right? It's very strange. What were we talking about? What makes it worse and is harmful, and when we do the little role plays, we ask you to do it wrong first. Because we've mentalized our audience and done this more than once and have realized that when it is wrong, it's easier to do. And then inevitably people just do it right. And debating facts, arguing, getting cognitive, acting like a politician in a debate where you just never answer, like that is harmful, don't do that. In prove it mode, you're gonna see kids doing stuff that's crazy, pulling for response, say my name, ripping up every floor tile, and only when you call the therapist at midnight or prescribe yet another drug that you think is stupid or whatever. Right. And it's that pulling for action. You have to admit my child again for the third visit to the ER today or I'm never gonna stop, right? That is prove it mode. If you don't act, anyone here married? I am. I can't find my ring. How big should the ring be? Well, 2 months' salary. We have built into highly affectively charged situations and unbelievable sales pitches when you're asking someone the most charged question you could possibly ask them about a close relationship. Don't rely on their ability to imagine your internal states. Use concrete and expensive evidence. And there is an inverse correlation between ring size and duration of marriage. So the more you need to prove it, maybe the less good of a mentalizer. I don't know. Carlene hasn't lost her ring because she doesn't have horrible ADHD. But it's not huge, and she still believed me. Yeah, right. And so I know she's a good enough mentalizer to understand that both it's perfectly reasonable that I lost my ring and not because I can't keep track of things. And that's not because I'm breaking up with her. It's not that I showed up and like, you're a dog. It's like, no, you lose things all the time. I understand. I'm the one who said yes to that in the first place. And some days I rue it, but. In ourselves, we'll notice anxiety and a wish to act. Yes, let me do another thing. Let's schedule another visit. Let's go 5 minutes, 10 minutes, 20 minutes. See you tomorrow. Right. And that pull to do, that is data about what's happening. Baby, I'm so sorry. You can tell that I'm sorry because these are flowers and I bought them. Do you get it yet? This is not enough flowers. It's not an adaptive way all the time, but in that moment of heat when you're so worried about what someone else might think, the only way you can prove it is with action or concrete proof. Every rom-com is basically just like non-mentalizing modes as a socially sanctioned way of behaving. So just take all of like Love Actually, which is the worst movie of all time for this, and just like nobody can communicate their feelings with words and everyone has to act and they can only be understood through action, say anything, showing up, I love you, and you can tell because I'm doing a thing that's stupid. Stalker behavior. Don't do that, right? But it is socially sanctioned in those rom-coms. So what we recommend in prove it mode is validating the need. There's an elephant in the room and we call it out. We focus on the dilemma. Well, you want me to prescribe a third antipsychotic? A lot. In normal, well, it's not indicated to prescribe antipsychotic polypharmacy. And what MBT would say is in that moment, if we recognize non-mentalizing, you say, it seems like you really want me to prescribe this. Question mark. and leave it there. Get to a place of understanding, and we'll show you how to do that. And excessive doing can get you into trouble. Proving that you care, nice sometimes you have to. You don't always get a choice about being curious about tigers, right? Someone's gonna die, intubate. But in other times, not. So you shouldn't intubate people who don't need to be intubated, and you should not intubate people who do need it, and emotionally the same thing is true. This problem solving, again, sometimes you solve problems. The best time to solve those problems is when mentalizing is occurring. So restore mentalizing, then solve problems, not have problem solving intrude onto emotion time. And this concept of elastic versus flexible, elastic has to snap back eventually and be more restrictive, and that's not necessarily the best. So flexibility is good, but boundaries are loving, and thinking about those boundaries and why together is what we recommend. And mentioning and calling out that elephant in the room is the idea. So it seems like you really want me to admit you. Am I getting that right? That's the sort of stance we're advocating. What we see in the too cold side of things, those are both too hot, this is too cold, in pretend mode, is meaningless words. Yeah, I love them. Oh, yeah, my skills, did my diary card, it's great. Did you use any of the skills during your suicide attempt? Oh, no. No, but they're really helpful now. Yeah. And so the problem with pretend mode, which is perfectly adaptive in the context of being polite, of calling a customer service rep, of blah, blah, blah. These things are not necessarily adaptive in the context of trying not to kill yourself. And we will see feelings and words not matching, a lack of affect around things that we think, at least, should have some weight. And you'll feel bored. You'll feel detached. You'll feel like, this is going great! They're using my therapy skills! They had an insight! I am an amazing therapist! But everything we do in session kind of doesn't matter, because it's about what happens out in the world that we're actually trying to change. And so it's this very weird situation where we can't be with them when the crisis is happening in real time most of the time. And we're trying to affect change that we're not there for. And so feeling like therapy is going great in therapy every time is a sign that it's not. Because what we want is change in the world and them able to rupture and repair on their own, independently, out of the flight simulator environment where they're constant agreeing with you. Oh, you're so right. Yeah, I am so right. I'm great. So that feeling that you're doing like perfect on, yeah, got through all the skills. Not necessarily great, question mark. It may be a red flag for having been in some pretend mode, which is completely normal. This happens all day long. This is politeness. Politeness is two people agreeing to lie to each other about what they're really thinking. It's my pleasure to answer this phone call for you. Probably not. It's probably your job. I'm the 9,000th call today. Yeah, thank you so much. I really appreciate the time you spent. Just give me my password. Right? But we're agreeing in those contexts because that's the social context to lie to each other, but not get enraged about someone lying to us. That's kind of a weird miracle. And when that happens in the context of psychotherapy, it's not, we shouldn't be lying to each other. We should, like we both agreed this whole time, are we really in that much agreement, is what MBT was. And so we would argue in these contexts to probe the depth, but how much? Really? To challenge, and challenge is a word we use here, is basically a tripwire for cognition, like Cowabunga! In the middle of, like, that's a way to just, wait, what? And wait, what? Creates a space where mentalizing can be restored. This is a here and now with us therapy, and bringing it to here and now with us can bring up that affective temperature. And when things are too cold, you can make it about the relationship, and that'll amp up the affective temperature, get you closer, curious. One of the ideas. And addressing the shared dilemma. You want me to admit you again, but it's the third time this week. And that means, I don't know. We're stuck. Acting like pretend mode is real, iatrogenic. Letting it go on and on, using, here's a great insight for you now that you're
agreeing with everything I say. I'll give you more things you can agree with, not useful in this moment. And using those non-mentalizing modes to teach skills when there is no curiosity present, not the right time. It's intrusion of skills onto a non-skill learning time. And so we're reconceptualizing personality disorders in young people as a mistrust in social information, which they've probably earned through their experience. Boiling it down, that P factor, Great Smoky Mountain study, sick kids are sick transdiagnostically. And you take that biological unwellness, early attachment disruption, you add some trauma, and you have epistemic mistrust in social information. So when you worry that people are lying to you all the time, because for many of our kids, the world is lying to them all the time. We really care about children. Why are there so many shootings? Well, because guns are important. How important am I? Plus stress leads to failures of mentalizing. And among people who are enthusiasts of guns, denying their enthusiasm similarly would breed mistrust. You don't trust me. I have a colleague in Nevada who opened a therapy practice which is branded as for gun owners because he's extremely serious about suicide prevention. And he recognizes that people with guns shoot themselves. And so by creating a therapy practice for people who are gun owners, who are welcome there, they know they're not going to be school-marmed and judged, and he's going to get more of what he wants, which is less dead people, if he created a space where gun owners felt they were going to get care. Yeah. Yeah. Because mistrust matters. And so this isn't just about nice people. It's not just about well people. In fact, this treatment works better in people who have more problems and who are more at risk compared to standard management. My patient said this to me once and used with permission. I have a problem with trust. People say nice things, but I have alternative facts. And I wonder why they're lying to me. And so we'll be doing this in our groups, but basically you're asking, am I mentalizing first? And if it's no, well, get yourself back online however you have to. You can, whoa, cowabunga yourself. And when the patient asks, what are you doing? You're like, I got distracted. Happens sometimes. If you are mentalizing and the patient's mentalizing, you can continue that curious focus on an internal world, or you can identify the mode and fix it by heating up the temperature or cooling it down with the interventions we talked about. This has a process in the session, and it's really tempting to go from story of event to alternative perspective. Oh, you said Jenny hated you. I think Jenny might have felt something different. Shortcut. Oh, well, what was it like to have Jenny hate you? Thinking about it now, how much of Jenny hating you was what was going on? What do you feel talking about that in the room here and now with us? Oh, now we get to the alternate perspective. So it's the longer road to have this really stick the landing. It's not just shortcutting. You said this, it's maybe this. You're a brilliant therapist. Done. Right? Everything we do in psychiatry is like, sleep more. If you need meds, take them. You're probably not as bad as you think. Pull your like, don't be so hard on yourself. Can you imagine if we could just say that and be done? This is also, if you end up doing this as much as we do, it impacts your life too. And so a direct care staff member at a hospital I worked at, it helps me understand how to approach the kids and helps in my personal life. Yes, it does. And imagining this emotional press secretary, right? The press secretary's job is spin. And this concept, which is very analytic, but to recognize that kids will have mistrust. They have a press secretary being like, why are they being nice to you? You're garbage. Niceness is lies. That, once we recognize there may be an emotional press secretary spinning what you say in the room next to you and your patient and saying like, don't buy it. That niceness, no, they're just trying to work you over. That is going to change the dynamic when you imagine that might be there. And so this alien self is what they call it in the British manual, the internalized malevolent caregiver, that emotional like second guessing, that causes a lot of problems. So if we assume we're always understood as nice and caring, we're getting it maybe wrong. Because sometimes there may be mistrust about our role. We see this in, anyone here seen The Sopranos?
back in the day, right? There's great examples of personality disorders in that show. But picking a fight with somebody because you feel under attack. I was just defending myself. For some individuals, it can feel so discordant to be sitting with yourself and have no actual attack happening that you'll poke and prod other people till they attack you, and then your world makes sense. You'll pick a fight because it's more sensible to have a fight happen than to have no fight happen, and then your world is weird. And that fight can even be with you. Why'd you try to kill yourself? I don't know. You don't know? No, I don't know. And one of the ways you can know is by acting. And so I must have felt really bad because here I am after a suicide attempt. It's a way of establishing coherence. Duels used to be normal. Now they are still normal, but we call them shootings. And there are a lot of them. But we don't, it's not normative for politicians to do so, like Alexander Hamilton or whoever this was. I was teaching this once in the state hospital setting with teachers, and I walked in, and all the teachers had purchased their own copy of the MBT manual, and they were all waiting around the table for me to come in as a teacher. And I spent every week for an entire year, 52-hour-long sessions with school teachers, and they proved it to me that my teaching meant something to them because they were so ready. We all do this all the time. It's not necessarily maladaptive. We're always trying to demonstrate, and just recognizing that it's happening is the answer. So that is my intro talk, the review. This is developed in the context of attachment, transdiagnostic ideas. I mentioned personality disorders, but it's not really what this is about. It's about recognizing that mistrust exists, and curiosity is our medicine to break through the barriers that mistrust creates. So this works by restoring trust in those relationships. We get less impulsive behaviors by working on the process of restoring trust, which means there will be some ruptures. And most practitioners doing this worldwide are not master therapists. They are direct care staff, they're nursing. The vast majority of people who do this aren't Jedis presenting the material, they're just doing it every day. And that is the review. When in doubt, when kids are too hot, relentlessly validating. It's like drilling for oil. Did you hit oil yet? Well, we went down 5 feet. But is there any oil in? Not yet. Keep going. Keep drilling. We want to get to that core understanding. That is the gold of trust. It's like, oh, it was Jeff 3 days ago. Now I get it. That's my talk. Pause. Yeah.
I'm sorry. Could
Please.
you get back to the
Yeah.
maybe fresh slide back when I got lost?